was a rumble in the jungle. Once I heard Dad was outside again counting birds, and Mama plugged in a nightlight, and I saw the queen of the world.
Welcome to the Golden Hour Birth Podcast. I am your co-host Liz, and we also have Natalie here. And this episode is part 2 of Kaitlyn's birth story. If you haven't listened to part 1, go back to the episode before this and give it a listen. We are up to the point where she had been pushing for about 4 hours, and her doctor had mentioned a C-section. And keep listening for the rest of her birth story.
Well, I'm not saying that you have to, but we got to think about, and I was like, if you're not telling me that I need to have a C-section, I'm going to keep pushing. And he was like, okay. And I'm like, basically, leave me alone. Looking back now, I'm like, wow, OBs really do nothing but come and catch the baby or cut it out of you, because at no point was he like, you know what, well, let's try this or let's try that. Not that he isn't a fabulous person or that some OBs wouldn't do those things, but in my experience, it just doesn't seem to work that way like it does with midwives. But I was like, all right, well, if you're not telling me I have a C-section, I'm going to keep pushing. And he's like, okay. So he went off to do his thing. And in fact, he actually had another C-section to do. So he went to do that. I feel like I said, the room energy really changed when this other nurse took over, and I had this new fire in me. I was like so determined. I was like, not that I wasn't before, but I felt like I was in a race against the time clock, and the race was against the scalpel. Like I was either going to push her out or I wasn't. And if I wasn't going to get her out in his time, like I was going to have a C-section. And so I was like pushing, and I kept saying things like, I'm going to push this baby out. And she just wouldn't say anything. The room energy really changed. And I was really saying things like, all right, I'm going to push this baby out. Basically giving myself now what I know were positive affirmations, just to be received with like a brick wall of a face that was just like not saying anything back at me.
Yeah. That sucks.
Yeah, it was weird.
Yeah.
Because I'm like, you go into nursing for a reason. It's like to help people, like pushing, just doing the same old thing, pulling on a dog toy, laying on my back and my knees to my ears. Like no one's suggesting anything else, just going at it. And same thing. I'm just +1, +2 station every time with push, but she goes right back to 0, which is at that point, it got later at 10:50. He comes in after this last C-section and watching me push, and nothing's changed. So basically tells me that your baby's not going to come out this way. So I didn't really know what to say. I just kind of got really mad and really sad kind of at the same time. They just turned off my epidural. I don't remember any like consent process. They maybe just assumed that I already knew the risks and benefits of the C-section, my job, and that I do them regularly. But I still just was like, okay, so that's it. You're just going to tell me I have to have a C-section and leave. So they turned off my epidural, which kind of sucked because they still had to clean up the OR after the last C-section and get it reset up for my C-section. And so in that time, like now I'm like having all this pain with my contractions. And I'm like, this sucks. Like these contractions are useless. They hurt so much and they're pointless. And I remember just being like so crying and angry and trying to do my makeup so that in the OR, when I had pictures taken with my baby, because I knew it was about to happen, like smearing my mascara everywhere. I'm like, this was so pointless. But I remember I just texted my coworker that was on that day, because it was a different guy now because it had been over 24 hours. And I was like, can you please come dose my epidural? They turned off my epidural. And he was like, yeah, sure. He came in and I was like, I'm so sorry. I didn't want to bother you, but these hurt so bad and they're just for nothing. And I was like so depressed. And he was like, yeah, I got it. He's like a big teddy bear of a guy, but doesn't talk a lot. I know he like felt really bad for me, and we still talk about this once in a while. But so he came in and he started dosing me up with the stronger, like surgical dose lidocaine, so that when it came time to actually make incision, I'd be comfortable. And they're getting me ready, which was like super weird because I'd helped prepare people for C-sections like how many times. I'm watching them shave the pubic area and get all the hair off and unhook all your IVs and turn off the pit, all the things. And I remember just being like, God, this is so weird to like watch it for me. And
yeah.
And I think all of a sudden I kind of found my voice back and I was like, you know what? Hey, nurse, make sure they give me my baby in the OR because we do not do skin to skin enough here. I want you to advocate for me. And she was like, okay, I will. Yeah. And I'm like, we do not do enough here. Advocate for me. I want that baby in the OR. And she was like, okay, yeah, we can make that happen as long as everything goes well. And I was like, yeah, make it happen.
Yeah.
And then I remember looking at my coworker and being like, all right, this is what I want. I don't want morphine in my epidural. I just started dictating my anesthetic plan. That's what he still laughs about today. I remember being like, I don't want epidural. I don't want morphine in my epidural, even though I really probably should have taken morphine in my epidural. I put it in people's because it really helps significantly with pain. But my friend had just had a C-section 3 weeks before, and she had puked for hours after hers. And I know what they could have given her to reverse that. And I know what they could have given me to reverse that. But in my mind, that was like so raw with everything going on. I was like, just don't give me that. I can't imagine puking against a brand new, like open abdominal incision. Just please don't give me any morphine.
Yeah.
Please do TAP blocks for me after. So I don't know if anyone has talked on your podcast yet about C-section pain, post-op pain management or anything, but
Not really.
I regularly do what are called TAP blocks for people at the end of a cesarean section or other abdominal surgeries in the OR. And what that stands for is it's a transverse abdominis plane block. So we use the ultrasound at the end of the cesarean section. They've closed you up, all that. I utilize an ultrasound machine to identify the 3 muscle layers in your abdomen and your spinal nerves as they exit your spinal cord. They enter your abdomen to innervate the skin, sub-Q, and muscles of your anterior abdomen in between the second and third muscle layer, between the transverse abdominis and the internal oblique. So we can basically utilize an ultrasound to identify the layers, guide a needle to them, and just under real time with the ultrasound, and inject numbing medicine in those locations on either side so that it spreads and you basically have pretty good post-op pain management for anywhere from 12 to 18 to 24 hours. I kind of give people a range because it kind of depends on how quickly your body uptakes it and things like that. But so I was like, Joe, give me TAP blocks. I got it. I got you. Because at the time it was only me and him doing them there. And so I was really glad that he was on that day. To do that for me.
Yeah.
I'm like, okay. So I'm like crying as they're like rolling me through the double doors. And I'm like, actually at that point, I didn't think I was crying anymore. I was just like kind of numb because I'm like, this is so weird. I was physically numb because he had given me so much numbing medicine, but I was also just like mentally so exhausted from what had been like 32 hours and like pushing and just knowing that, well, I guess my job is done. I just have to lay here now. The OR was like so cold. I couldn't control my shaking. But the more I think about it now, I think a lot of it was also adrenaline because I looked up at the monitor at one point after they put me on the monitor. I looked at my heart rate was 140. And I was like, awesome. Great.
Yeah.
I was like, that's a high heart rate. Yeah. She's like, you're okay. Just take some deep breaths. I'm like, okay, I'm trying. I feel like I know too much about what's going to happen, but okay.
You do.
So they start prepping my belly and they put the drapes up and they're like literally standing there next to me, my OBGYN, discussing my increased risk of hemorrhage because I have been dilated to a 10 for so long, which apparently puts you at an increased risk of hemorrhage, by the way. So he and my coworker are talking about what my coworker is going to give me to help mitigate the risk of me hemorrhaging. So I'm like, oh, wow, that's great. The drapes are going up and they bring my husband in once they like pinch that area of my abdomen where they're going to be working and confirm that, yes, it's nice and numb. And so Matt comes in and I do not even remember like his reaction to most things throughout this whole labor, which really makes me sad, but sorry, I was really focused on other things. And I remember joking with my coworker, like as they were doing things like, oh my God, here comes like the bladder blade. Like I could feel everything they were doing, like the tugging and painful, but it was like really weird to feel them like touching you and know what they were doing without actually like seeing it. Because I had pushed so long to get her in my birth canal, they actually had to go below as well. So they had to prep my vaginal area and a nurse had to put like sterile glove on and push her back into my uterus because she was not deliverable the way she was. She was so far down. I don't remember feeling that. Awesome. Great epidural. But I just remember thinking like, babies come out usually really quite quickly in C-section. They get through the skin and, you know, all the layers they need to, uterus, and you hear them, like often they'll say uterine incision because that's something that they document. So I heard them say it. I'm just like waiting. And we have this clear drape that is blue, but there's a window. So we as anesthesia will drop that when the baby's coming out so mom can watch the baby come out. And I'm just like waiting for my coworker to drop this tray. Just waiting. And I'm like looking up at him because like I'm upside down basically at this point I feel. And I'm looking up and I'm like, why do your eyes look like that? He did not look like someone who's like, excited to watch their coworker have a baby. He looked a little nervous and I was like, what is going on? Why do your eyes look like that? And he was like, me? What? Everything's fine. And I just believed him because I was so exhausted. I didn't have the mental capacity to read through that apparently. And then I heard my OBGYN tell the staff to pay a pediatric rapid response. And at that moment, I was like so confused. I heard him say that. And so I was like, why are you paging a pediatric rapid response? And the room got really loud. And I guess the baby was delivered and I wasn't even aware of it. I didn't hear her crying, but I saw them like rush over to the warmer, assuming they had her. Super confused. So I didn't see her. So I didn't know. They told me she had an FGAR of 3. So she was limp. She was purple, no tone, not breathing. Her heart tones had been great, fabulous the whole labor. But because they had to go vaginally and push her back into my uterus, she, at that point, instead of just going straight back up, had flipped transverse. She bounced right off of that nurse's hand and up and at an angle. So at that point, it became more difficult to get her out of what is a 4.5, 5-inch incision. So my OB was manipulating her, trying to turn her, trying to get her back into the head down position so he could deliver her out of the lower uterine segment incision. He's turning her, and I guess struggling to do that. And then at some point, he ended up actually delivering her in a breech manner, butt first, out of the incision because he could tell that she needed to come out now. And that was when he had paid the pediatric rapid response. He could feel how limp she was intrauterine. So she went to the warmer. I didn't see her, but I could tell everybody was like in a tizzy trying to get her back. I shouldn't say get her back. She wasn't gone, but it was still a resuscitation. It's neonatal resuscitation. So we started giving her rescue breaths because she wasn't breathing. Usually that's going to fix whatever's going on. And it did. I didn't even know she had started. I didn't even know what was going on. I just could see everybody around the warmer. And then my coworker, because we are always on standby as the person that will intubate the baby if it needs to be intubated. So I'll put the breathing tube in if it has to. I've been lucky enough to not have to do that yet on one of my shifts up there, but I know it's happened to him quite a few times. So I know that's kind of where his head was because he was over by the monitor, like looking at her over by the bassinet. And I remember him yelling over, Kaitlyn, did you hear that? And I was like, hear what? No, what? He said, she's crying. And I was like, oh, and they like lift the mask off her face and I hear her crying. Oh, good. But they put it back on to keep giving her oxygen, a little bit of CPAP. And so like a wave of relief like hit me. And I felt like at that point, I don't remember like anything after that. I was later. Oh, wait. No. So then my coworker was able to kind of turn his attention back to me because he knew the baby was okay. And they were struggling to get my bleeding to stop because, like we had mentioned before, when the uterus is stretched, especially for that prolonged period of time, it doesn't want to contract back down as easily whenever it needs to after the delivery. So they had already started pitocin, which is pretty standard, through my IV after baby was out. And I guess my uterus still wasn't contracting adequately. So I'm trying to read notes at the same time. Because again, I don't really have a memory at this point. So I have to go off of notes. But so at that point, I knew she was doing better. They told me that at her 5-minute mark, her FGAR was 9 and her next one was 10. So she did great. But they were having a hard time controlling my bleeding. At some point, my coworker had called down to the operating room and just said, hey, if there's anybody extra available anesthesia-wise, he could tell things weren't going super well for me. And I think he had actually called when the baby wasn't doing well too. So he was kind of like calling for extra hands just in case they were necessary, which was super smart, especially during the day when that's available. So by the time they came up, Isabel was looking great. She did not have a name yet, but she was looking great. The pediatrician was evaluating her and just really impressed with how quickly she had pinked up after all of that.
That's so good.
But they were, yeah, I'm so glad. And I forgot to mention there was a nursing student that asked to be a part of my care. And she was in there while I was pushing and everything. And I remember them asking if she could be in there. And I remember just being like so exhausted and not really wanting anyone else to see me like at what I felt was like kind of failing at the time. But I'm like, yeah, that's fine. Everybody learns. I've been the learner. I don't even know how many times at this point. So yes, like it is my turn. Let her, yes, she can be in here. And she was asking some of the dumbest questions while I was pushing. At one point, she asked my nurse, what would happen if I didn't push the baby out today? And the nurse said, the baby is coming out today, one way or the other. And I was like, oh my God. So I'm like, what? How did I end up with this student? What do you mean? Then the karma came back, and I have all these fabulous pictures on my phone of my daughter, because obviously I wasn't getting them. My husband was a little busy with me. There are hundreds of pictures on my phone of when my kid, after resuscitation, looked great and everything. And I'm so thankful for that, because otherwise I would not have those. They're my memory, like, of what happened, right? That and people telling me work. But eventually a couple more of my coworkers came up, because I guess one of them was on a lunch break, and then another one was like my boss, who obviously was invested in my care at this point too.
Yeah.
And they ended up going under the drapes to give me Methergin in my thigh. Methergin is another uterotonic drug that helps the uterus contract to decrease hemorrhaging. So they went under there, did that. And then they ended up giving me Cytotec rectally as well. And then they injected intrauterine pit also. And they gave me TXA. So I'm like, wow, they literally threw like almost everything at me that they could have thrown. And I guess it worked, because eventually it did stop. But I remember certain things here and there, but Joe had kind of been like, he could tell how uncomfortable I was, because they were having to do so much really hard manual manipulation of my uterus to try to get it to stop bleeding. And they're like clearing it of debris and massaging it to get it to contract. And it was like just super uncomfortable. And the majority of cesarean sections, the uterus is actually externalized from your body, is the word that they use. So it's actually not in you anymore. They pull it out so that they can get a really good view inside of it and make sure that they clear it of all the clots and placenta and everything to make sure that they can stop any bleeding. So they took it out and they put it back in and started bleeding again. So I had to come back out again. So they had to pull it back out again. And it's a horrible feeling it come out. And it's a really also horrible feeling everything go back in. So I remember them bringing it back out, and just like, oh my God, and then working on it. And my coworkers, they put it back in, see it's bleeding again. And like OBGYN looks up at my coworker, and I said, let me give you something to your IV. And I was like, no, I want to remember my birth. No. He has to externalize your uterus again. And I was like, oh, okay, fine. But only give me 20 milligrams propofol. Of me dictating my anesthetic plan again.
I love that.
20 milligrams is not going to do anything for you. You are so young, it's not going to do anything. And I was like, fine, whatever. I'm just like so over it at this point. So I don't really remember a lot after that for a while. They did eventually get my bleeding under control, obviously. And the final number on the estimated blood loss wasn't very high. I would love to know how accurate it is, but it wasn't too bad. So everything, they got me closed up and everything. They did end up bringing the baby over to me in the OR, which I'm a little bit like flabbergasted by. I feel like so often people are like, yeah, my baby didn't look great for like 30 seconds, so it went to the NICU. But like, they really did everything they could to make sure I got to see the baby in the OR, which really meant a lot to me, because I'm not sure that would have happened for other people. But she really did. She looked great. She had perfect AFGARs once she actually wanted to breathe.
Yeah.
Again, I don't remember meeting her, which is really sad to me, but I have lots of pictures of proof. And I do remember the nursing student, before they brought her over to me and before I got sedation, the nursing student came over to me. It was like the weirdest thing. And she put my phone in front of my face while they're closing me up. And she's, this is your baby. And it was a picture of her. And I hate to say it, but I was like, not excited. I have zero feeling. I was just like, oh, that's what she looks like. I was like, okay, that's not what I expected her to look like. But also, like, I was having a really hard time picturing her in my mind for 9 months. So
yeah,
I was just like, oh, okay. This isn't how I imagined seeing my baby for the first time, but okay. But again, I'm really thankful, because I could tell she was doing that to try to like make me feel better. And that's amazing that she had the empathy as like such a new healthcare provider to like even think to show me that. So I appreciated it.
That's cute.
I have hundreds of pictures on my phone of us, like her like laying on top of my neck, like all closed up. And like, I was still semi high, right? I don't remember this, but I started tugging on my gown. And one of my coworker friends, she was like, Kaitlyn, what are you doing? And I'm like, I want you to see the skin. I want to slap. And she's like, not right now. She realizes like, I'm so high, I would probably drop her. Like, but no, I remember just saying, what? Why not? My voice on propofol is very annoying. Also, I hate the sound of my own voice recorded, so I don't know if I'll ever listen to this. But The voice, my recorded propofol voice, even worse. So bad. So yeah, then at some point they were like finally done, and they guided Matt to our room, back to our room, and they had him take the baby, and which is so funny because like they weren't like, no, she doesn't have to go to nursery. She's great. I'm like, oh, fabulous. And I remember asking him during the C-section, I remember being like, and I was high, so I shouldn't say I can remember. There is a very short video of me asking him, because we're not supposed to video in the OR, but my friend was very nice and took a video for me of me holding the baby. And I said, did you cut the cord? And he was like, no, they did that already. Because it was such a big hurry and everything. And I remember I'm still really sad about that. I'm so sad that he didn't get to cut her cord. I don't know. That just feels like a rite of passage for dads, right? Like even C-section dads, like we have them come over to the bassinet and cut the cord. But I get it. They were busy, but she was keeping them busy, I should say. But yeah. And then so they went off to the room, and he would tell me later, he was like, I remember standing there in the room. He just left me in the room by myself with this baby that they had just resuscitated. He doesn't know the word resuscitate, but this baby that they just had to like work on. And they just left me in the room with her. And I'm like, is this okay? Part of me is like, I guess he would have called if he stopped breathing. But
you're a dad now, buddy.
You're a dad. Like, it's all you, man.
Yeah.
And he did some skin to skin with her in the room while they finished closing me up. And they did my tap blocks in the OR so that I could be more comfortable later. I'm also super, super sad that I missed that. The other day, I randomly started crying about that because I watched a birth video. And the dad like was doing skin to skin, and like I just started like randomly crying, which I did not expect. I'm not a big crier, except when it comes to that kind of stuff. And he, like, my husband was like, "What are you doing?" And I was like, "I'm just thinking about when you got to do skin to skin with her before me, and I didn't even get to see it." Like, like there are way more traumatic C-section stories out there. I'm not trying to say mine is the worst by any means, but it just felt a certain piece of things was not robbed, but it didn't happen the way you want it to happen, like the way you think about it your whole life. Like I've been interested in birth since I was a kid. And so I think I always thought it would go like the way it's supposed to go. Like I work out and I eat somewhat healthy and I sort of studied babies. So I think I just always thought, oh, it'll be good.
Yeah.
But
you prepared the best way that you could. Like you didn't know that she was going to be hitting your pelvis.
That's true. I did not know. And there's so many things I would do differently, but hindsight's 2020. And even if I did do them differently, I can't even know that anything would have changed. But yeah, that was the way that went. I don't really have any memories again until about, I think it was like she was born at 11:17 a.m. And then my first memory is at 1:35 p.m. And I know because I took a picture because Matt was like holding her for several hours of her life because I was really tired. I think I slept a lot of that. And I remember taking a picture of him holding her. Still one of my favorite pictures. And it's dated it's timestamped 1:35 p.m. That's how I know, like, I started remembering things then. And like, I saw all these texts on my phone that were just like, I was like, oh, I can't reply to this. And Matt was like, don't worry. I already texted your mom and dad a picture and told them everything. Because they had known I was going back for a C-section. And in fact, my mom had come to the hospital while I was pushing. And even though we had said we weren't probably going to have them in there during pushing, but she had come up and she knew a long time since I started and she was getting concerned. And the nurse, she had asked if she could come in. And the nurse was like, basically saying, no, she doesn't. They asked me and I said, I don't think that I can do what I need to do with her in here because my mom is one of the few people, and I'm sure you ladies can relate, like that I just will break down in front of if that's what I need to do. And I knew that I would start just bawling. And I knew that at that point, that's not what I needed. I needed to be like as strong as I could and just push. And I still feel so bad about that to this day, but like my mom had to hear from some nurse that like I didn't want her to come in there, but I think it was just like, I think she also understands. And I'm very vulnerable only with you, Mom, mostly only with you. But so then she ended up coming up and seeing me, and my dad came in for 30 seconds. And I think he's obviously very uncomfortable with like birth and all those things. And of course, that was when they happened to like, the lactation consultant came in and was like trying to teach me how to breastfeed. Like, wow, this is like perfect timing.
Yeah.
And I remember feeling kind of drunk still. And this is what I remember thinking, like I'm holding her and then they're like teaching me the football hold and they're teaching me these things. And I remember just being like, okay, this is like I'm going to relate it to when you're like really drunk at a party, like in college, and you're like, this really cool thing happened. I'm going to try so hard to remember this tomorrow. I felt like it was like that, like learning to breastfeed. Like, oh yeah. I'm like, okay, that's the grip. Yeah.
That's the grip. I love that.
And they were like, yeah, if you do a football hold, it's going to put as much pressure on your incision. And if you do this, and like, unwrap her, do skin to skin. I'm like, because I was like, this is the thing, we're gonna do this right. So yeah, I will say, like, the first day of her life was very overwhelming. She didn't have a name. I didn't feel like I did enough skin to skin with her. Probably I didn't make that happen. And I do think that people say they worry about like their bond after a cesarean section. And I totally understand now. And like, I would never want her to think that I didn't love her. But like the first couple hours, my sleep deprived, like weird emotional brain, hormonal brain resented her like the tiniest bit. And so I was like, okay with Matt holding her, because I just was like, I don't even know how I could do that right now.
He didn't go through any of what you went through. He was in the right mindset, and you were trying to maneuver all these drugs that were in your body.
Yeah.
I have no. Yeah.
Yeah. It's like you ran a triathlon, or like
maybe like 3 triathlons,
and then the swimming, and then the running. Yeah. You went through the gauntlet.
Yeah. It was hard. And now I look back at it and I'm like, and I hated it at the time. One of the nurses, my post-op nurses, would say, but Kaitlyn, you are going to be the most empathetic CRNA now, though, because you have done epidural and the labor and the C-section. At the time, I was just like, bitch, that is not what I want to hear. But I will say it really is true, because anytime like I do, like especially the labor to C-section, when we are transitioning from, okay, you've been laboring to C-section, I just feel like I'm probably a little bit better in those situations than my male counterparts ever can be, because they've never had to experience that, and the emotional side of it, let alone the physical. They'll never know that. We've never asked a man to undergo abdominal surgery awake, just saying.
Oh, and then here, take care of this baby.
Exactly. Immediately after. Exactly.
I think you should go to management and just let them know that like your paycheck should be higher.
Yeah. Like, I'm like so empathetic now, guys. Like, I'm providing this service for you.
Yeah.
No, but like I try to tell them like what to expect from it, because they don't get enough of that. And I think someone that, like I said, like I did C-sections all the time as part of my job. I didn't realize how truly painful they are after, until you go through it. It's the most common surgery performed in America. So I think we really not undervalue, but I think we what's the word I'm looking for, ladies? Like we underestimate. Yes, we underestimate how rigorous it is for the human body to go through that, and the pain that you experience after. And like the point you made, Natalie, you also have to like keep a human alive after. And some people do that by themselves. I don't even know how. But I feel like there's a lot more that could go into like post-maternity care for all women, and a lot more education too about what to expect from a cesarean, because even I didn't know how hard it was going to be. My tap blocks wore off about 14 hours later, and it was time to get up to the chair at 3 a.m. for her next feeding. So I remember them like helping me. They were like, okay, this is how you sit up without using your abs. And I'm like, how? What? And I'm like doing it and using my arms on the side rail, and they're like teaching me, and I'm still using my abs. Like, how do you pull yourself into a sitting position without your abdominal muscles at all? And I'm just like, oh my God. And they're like, try not to use your abs. I'm like, I'm trying. What are you talking about? And then it's okay, we're going to help you with this abdominal binder on, like wrapping you up, which it's like really uncomfortable at first to put on, but then you're like, wow, nice core support, because my core is gone. And then they're like, okay, now we're going to stand. And I just remember like Matt being over on the couch and him like sitting up, and like a day is like watching me, just like them helping me stand up. And I'm just like bawling, like tears are just like rolling down my face, because I'm like, why do we have to do this? And they're like, you need to move, like you need to get up and walk. That's the way you're going to get better. And I'm like, oh my God, this is horrible.
Yeah.
And at that point, I'm like, I really should have let Joe put that morphine in my epidural. But then got into the chair and fed her. And that 3 a.m. feeding is the first time like I really feel like I bonded with her. Like I took a couple of pictures of her, like holding her, and she was like a little alien, little tan alien.
Yeah.
We were being like, this kid's jaundiced. This kid, I'm not a tan person. This kid is. And they're like, oh, she doesn't look that jaundiced. And I'm like, okay. And then we went right before we went home. The nurse practitioner was like, yeah, I would like you to get into your pediatrician tomorrow or the day after because she's still jaundiced. I'm like, yeah, I know. Thank you.
Yeah.
But I was like, man, this kid's too tan to be mine if it's not jaundiced. But that first feeding was so great to be able to like, okay, like I did this. Like I figured out how to feed her and I'm holding her and she's like, okay, I can actually really look at her face and hear and unwrap her from her swaddle thing. And she was just, we didn't have her in any clothes or anything until the day before we went home. Because like, I didn't think about that. Like I had a going home outfit, but like, it was nice to just unswaddle her and do the skin to skin and stuff. And then just learn how to re-swaddle and everything. And I remember Matt at one point in the hospital being like, I've never had any desire to hold a kid before. And it was actually like, I'm so scared of holding kids. It's totally different when it's your own. And I was like, oh, so glad you said that. That's so sweet. It's so funny to watch your partner that you've known, I've known him for so long, watch them turn from like the toughest dude into a total softie for their baby. Like it's just transformative. It's amazing. But
love that.
Yeah. Then we went home and things were good and she met the dogs and she's got a brother and a sister. Then they mostly like her. The lab loves her. We have a Chow German Shepherd mix that just kind of like chooses to stay away from her, but he chooses to stay away from us too. He's a very cat-like dog. And now that she is 18 months, she's very bold and she'll like, today they were trying to eat some of her taco meat and she went, no, and was just like pushing them out of the way. I was like, oh, let's be a little more gentle with the dogs.
Yeah.
Dogs are animals.
I feel like that's how Wes and Ruby are. Like Ruby will give it to him, but Wes will give it right back to her.
That's a new thing. And I'm loving it. But I'm like, okay, we got to watch her. We got to make sure they're good around.
Labs and kids are hilarious.
Yes. Yes. Our little lab is great. But yeah. Are there any other wrap up questions? I feel like I've been rambling. I'm so sorry.
No, it was, you had me on the edge of my seat. Literally. I was like, what's going to happen? I just
realized I did a really bad job of staying in chronological order because all my notes are like a full out like document that I typed up last Mother's Day. And so it's like the whole birth story. I really should have gone through and made bullet points for this. I'm sorry.
No, it was so
I was like
good.
trying to read that while verbalize it in the right order, which didn't always happen.
Yeah.
No, it flowed really well. And I love that you got your medical records to see what happened. I did the same thing.
Yeah,
I didn't think to get nurses' notes. I should order those.
Yeah, I just have it because at Mercy you have the like Epic My Chart.
Yeah,
but you guys delivered at Mercy, so you should just be able to look in your Epic My Chart.
Yeah, mine don't have the nurses' notes though.
I have all mine.
I probably didn't have many either.
You probably, I was like, since you delivered at the birthing center, you probably don't have as many because. Yeah. Do you
less checks
like,
and stuff?
What's their nursing staff like there versus? So they have the midwife present. Do they also have? I'm guessing they also have nurses down there, right?
Yeah.
For like IVs and stuff. Like I had to get IV and then get my antibiotics
they're not
before.
In the room. They're not like in the room with you like a lot.
No.
Awesome.
And then with my second, we shut them out.
Did you do a low intervention room at Mercy with your second?
Yeah.
Yeah, and we're in the bathroom the whole time.
Yeah,
we're like, we're good.
Stephanie and Jason were like, "No, go."
I love your stories.
Yeah, maybe I just don't have.
They're fun.
But yeah,
I need to start writing mine out for this one.
I've been asking my husband to write his side of the birth for a year, and the other day, I shouldn't say the other day, a couple months ago, I was like, hey, have you worked any more on that? And I knew that he hadn't because he had left his computer open recently and there was one page and he'd only gotten to when shortly after we got to the hospital. And I'm like, what are you doing? I was like, I asked you to do this 6 months ago. And I think it's really important that you write it down before the memories fade. Do it for me and Isabel.
Yeah. Guys don't process the way we do.
No, they don't. And he was like, for Christmas. It'll be done by Christmas. So in my mind, I'm like, I bet he's going to present me this like beautiful typed document as one of my Christmas gifts. And when we got home from Christmas, I was like, I can't help but notice you. I thought you were going to do that and you didn't. He's like, oh, I was going to. Just never finished it. Okay.
What are you going to do? We've been wanting to have Sam on forever. And then it was just
like he'd be great for this.
Yeah.
So, like,
I even have questions written out, everything for him.
Yeah. And like the one night, I forgot, like something just like emotions were brought up from like Sam's dad. And then we like canceled it. And then we just like never really gotten around to it.
Yeah.
We've been trying to book all these birth stories.
Past the year.
Yeah.
Is Jason interested in that? He seems a little bit less. I shouldn't say outgoing because he's in a band.
Yeah. He's like nervous. I think just about the like being recorded.
Yeah.
He's up to like on the.
Me too.
About what happened.
But yeah, from like your side, like Sam always brings up, like, it was so hard watching you in so much pain, like the person you love. I'm like, I can imagine.
Yeah, I'm sure.
Yeah.
But yeah, at some point I was like, my mom ended up just leaving because I was like, I mean, I got the epidural and then she was like, cool. And then it was like time for her to go to the hotel, be with my dad and like go to bed. And then that's when it got bad again. So I was glad she wasn't there when it got bad again. Because like, I can't deal with like how upset you're going to be.
Yeah, that would be rough.
Yeah.
Now as like a mother. Yeah.
Exactly.
I don't know.
Exactly.
So you had your water break 3 a.m. Then you had her at 11 a.m. the next day?
Yes.
Wow. Yeah. That was a day. And then how long were you pushing total? 3 or 4 hours?
4 hours.
4 hours. Oh my God.
Because they basically told me like 4 hours was like my limit.
Yeah.
And so
I thought 3 was the limit, but wow, 4.
And like I've listened to so many like stories and podcasts and stuff. And I would say it really depends on the practitioner and like what they're going to allow. Because I've heard some people be like, yeah, I finally pushed it out at 5.5 hours. And I was like, wow, I was like, if they would have told me I could have kept going, I probably would have, but I don't know that I would have gone for 5.5 hours. I don't know. It's a long time. It's exhausting.
It's a long ass
Especially
time.
the purple pushing where you're like,
yeah,
for like 5.5 hours. I can't even imagine, but yeah, I don't know. Really, it depends on the provider and like what they're comfortable with. And,
yeah. Wow.
And my coworker says that my OB let me push too long because of who I am. But I was like, I don't know. I think 4 hours is appropriate. I think that's an appropriate cutoff personally.
Yeah. I just had it in my mind that 3 was like the cutoff because I just feel like I hear a lot of 3 hours.
I've heard 3 too. Yep, yeah. I've heard 3 a lot. And every once in a while I'll hear 2 hours and I'm like, I feel like that's a little short to cut somebody off, but especially a first time mom, but
yeah.
Same with an epidural. Takes longer with an epidural if you don't feel the same. And was it yours only 27 minutes?
Mine was 31. 31. Or 30. Yeah, wow. Something like that.
Fabulous.
I don't know.
I'm gonna hope for that next time.
I will give credit to my doula. Like she was making sure I was like on the peanut ball and doing all these things with me. And now I'm like, fuck, why didn't I get a doula again?
You still can.
I'm due in like 2 weeks.
Hey, I hear that on podcasts all the time. They'll be like, I got like a super last minute doula when I was 38 weeks. Like nothing. Yeah. Finding someone with the availability would be the hardest part, but I'm sure you could. Or Liz, you could be your doula.
She's been saying, she's been asking.
I know.
Are you planning on
I'll be there if you want.
birthing center again? Or are you planning on Mercy Hospital?
No, I have Campbell. I'm just doing my OB.
Okay, so what's Campbell?
Okay, sorry. Yeah. Campbell's at OB at Mercy. But do I have a reason why? I think I was just like, I know I'm going to get an epidural.
Oh, yeah. No,
I don't know.
That's what you want, then yeah.
Yeah. So I think that's like the only reason why I ended up going with her. And then I was like, my doula was so knowledgeable. I'll just take that into my next one.
Yeah.
And hope for the same outcome.
Yeah. And you use Emma, right?
Yeah. We called Emma in and we're going to call her in again.
You're going to call her in again? No, I meant doula? Wasn't
my doula. It was named Emma, and then Emma Peterson.
Oh, so Emma, yes.
We called Emma Peterson in
to do the delivery.
Yes.
Okay. Yeah.
And then
just like, what do you mean you're gonna call her in again? You just said you didn't hire a doula. Got it. She's just gonna come anyway.
Yeah. She's helped me though, because we found out baby was breached, and I like called her right away, Emma the doula.
And did all the
I flipped her.
These things and flipped her.
I flipped her. I know.
Awesome. Good. How many weeks were you when you found that out?
34 and a half.
Yeah.
And then, I just got confirmation 37 weeks that I flipped her, and shit, I'm excited.
Did you feel it when it happened? Or was it?
I did so many different things. I did acupuncture, and like my first 2 times I like felt these huge movements, but I couldn't tell if it was like a flip. And then there was one night in bed where I felt 2 huge movements, and I was like, I think that was it.
Yeah.
And I think either like the acupuncture or the flip in bed was like the icing on the cake.
Dude, that's awesome.
Yeah, it was pretty crazy feelings. That's all I can say.
Random. And she's still taking clients and she's in midwifery school. Because on your podcast, she made it sound like she was going to try to do it sometime, but I wasn't sure she's too busy right now.
Yeah, I think she's taking 1 a month or something.
Okay. Because I saw like on Instagram, I had like an advertisement from her actually.
Yeah.
It was like an advertisement that was like ways to ensure I'm at your birth as I transition or as things are changing. And I'm like, I was like, oh, maybe she's not doing any doula stuff anymore, even though on the podcast she said she was going to try to keep doing some doula stuff.
Yeah. I actually connected her. Yeah. You guys would totally get along very well. And I actually just connected her with another girlfriend who got diagnosed with PCOS. Like, I need like more info. I need someone who's like going to like holistically approach this with me.
Yeah.
And so they connected and had a really good conversation.
Awesome.
Yeah. Yeah. Emma is the bomb. I will give all the credit to her. All the Emmas. Yeah. Thought about naming her Emma for a second there. And then I was like, I know way too many Emmas. Yeah.
Awesome. Is there anything else what should I do?
I think we're good. I feel like we'll probably have a bunch of questions after. I feel like this will be a good one to do like a Q&A.
It would be. Yeah.
Oh my God. I think I shouldn't say the last one. Whatever one I listened to, the girl
Carly
had the epidural that was leaking the whole time. I think that was Carly, wasn't it?
Oh.
Is that the same one that went on to have the unmedicated with a 10? I don't know. One of the girls had a post-dural puncture headache, and then her epidural was like leaking. And
that Amy?
On her. I was like,
yeah.
Yes. I was like in horror listening to that story. Like I was yelling at the radio. I'm like,
soaked.
Oh my God.
like
that's
soaked.
Not how this is supposed to go. I'm so sorry for you. Because quick fact, that only happens to like 1 to 2% of people to even get that like spinal tap, the post-dural puncture headache.
Wow.
And then for it to actually have also threaded into that space and also then be allowed to leak all over the bed. I was like so upset for her.
Oh my God. I guess I never realized how severe it was.
That would not be good.
Wow.
It's like a constant headache because like your CSF like surrounds your spinal cord and all the way up into your brain. And so like when it leaks out, the first place that it's most effective is like where you get to have the most pressure, which is like your brain.
Yeah.
And your brain starts to sag a little bit, and it's that tugging on the meninges, the protective coverings around it, that cause like an insane headache that is resolved when you lay down because that spinal fluid can re-equilibrate. So I'm like listening to this and I'm like, oh my God, this poor girl.
Oh my God.
Holy shit. And like me and Liz aren't medical professionals and we're just like, well, that's crazy. And now you're telling us, I'm like, holy shit.
I was like yelling at the radio listening to this. I'm like, this poor girl.
Oh my God.
Oh my God.
And you guys, you have a lot of medical professionals on. You're like, I think you guys like 5 or 6 episodes in and you were like, all of them have been in the medical field.
Yeah.
Thank you so much, guys.
Yeah, thank you so much for coming on. And hopefully we can wrap back around soon with Kaitlyn and ask her some more questions and maybe get like her little take on a VBAC for baby number 2, whenever that, not pregnant, but whenever that happens.
All right, thanks so much for having me, guys.
Yeah. Thank you.
Have a good night.